Hey everyone, and welcome back to our channel. Today, we're diving into a really important topic that affects millions worldwide but often goes unnoticed until it's quite serious: kidney disease. What if I told you that your body might be sending you visible signals, signs you can actually see, that your kidneys need help? We often think of kidney problems as silent, but that's not always the case. In this video, we're going to uncover the surprising signs of kidney disease you can see with your own eyes, from your skin to your nails and even your face. Sticking around until the end could be one of the most important health decisions you make this year. It's crucial to know that this video is for educational purposes and is not a substitute for professional medical advice. Always consult with a doctor for any health concerns. First, let's talk about why our kidneys are so vital. Think of them as your body's master filtration system. These two bean-shaped organs work tirelessly 24/7 to filter about 200 liters of blood every single day. They remove waste products and excess fluid, which then become urine. But that's not all. Kidneys also regulate blood pressure, produce hormones that help make red blood cells, and keep your bones strong by balancing minerals like calcium and phosphorus. When your kidneys aren't working properly, these waste products and fluids can build up in your body, leading to all sorts of problems. This condition is known as chronic kidney disease, or CKD, and it's a gradual loss of kidney function over time. The scary part is that you can lose up to 90% of your kidney function without experiencing any severe symptoms. That's why recognizing the early, visible signs is so critical. So, what are these visible signs? Let's start with your skin. Have you noticed your skin becoming unusually dry and itchy? When kidneys fail, they can't maintain the right balance of minerals and nutrients in your blood. This imbalance can lead to mineral and bone disease, which often manifests as severe itching, a condition called uremic pruritus. Your skin might feel rough, scaly, and constantly irritated. It's not just regular dry skin that lotion can fix. This itchiness can be deep and persistent, sometimes worse at night. Along with dryness and itching, you might also notice a change in your skin color. A buildup of waste products, specifically urochrome pigments, can cause the skin to develop a grayish or yellowish, sallow-looking hue. Some people might even develop what's called uremic frost, where urea crystallizes on the skin after sweat evaporates, leaving a powdery white residue. If you notice these changes, it's a significant signal. Next up, let's look at your face and body. One of the most common and visible signs of kidney trouble is swelling, also known as edema. Have you been waking up with puffy eyes? Or maybe you've noticed your ankles, feet, or hands are swollen, especially at the end of the day. This happens because damaged kidneys can't get rid of excess sodium and fluid effectively. The fluid has to go somewhere, so it accumulates in your body's tissues. The puffiness around the eyes is particularly noticeable in the morning because the fluid settles in the soft tissue there while you're lying down. Swelling in your legs and ankles is due to gravity pulling the excess fluid down throughout the day. If you press on the swollen area and it leaves a temporary dimple, that's a classic sign of this type of edema. While many things can cause swelling, persistent puffiness, especially around the eyes, should definitely prompt a conversation with your doctor. Let's move on to something you might not think to check: your urine. Changes in your urination habits are a direct window into your kidney health. First, you might need to go more often, especially at night. This is called nocturia. When kidney filters are damaged, it can increase the urge to urinate. Conversely, some people might urinate less often, or in smaller amounts. But the most visible sign is the appearance of the urine itself. Is your urine foamy or bubbly? A little bit of foam is normal. But if you notice that your urine looks like UVA just poured a beer and it requires several flushes to go away, this could be a sign of too much protein, specifically albumin, in your urine. This condition is called proteinuria, and it's a classic early sign of kidney damage. Healthy kidneys filter waste but keep protein in the blood. When they're damaged, protein leaks out. Another warning sign is seeing blood in your urine. This can make it look pink, red, or even cola-colored. While this can also be caused by other issues like kidney stones or infections, it's always a serious sign that warrants an immediate doctor's visit. Now, let's examine your hands, specifically your fingernails. Believe it or not, your nails can offer clues about your overall health, including your kidney function. Have you ever heard of half-and-half nails, also known as Lindsay's nails? This is a condition where the bottom half of the nail, the part closest to the cuticle, is white, while the top half is reddish-brown. This distinct pattern is strongly associated with chronic kidney disease. It's thought to be caused by an increase in certain hormones and chronic anemia, both of which are common in people with kidney failure. Another nail sign to watch for is the presence of white spots or lines across the nails, known as murex lines. These are not the little white spots from an injury, but rather pale bands that run parallel to the base of the nail. They suggest low levels of albumin in the blood, which, as we discussed, can be due to protein leaking through damaged kidneys. So, take a moment to look at your nails. They might be telling you more than you think. Beyond these specific signs, there are other, more general, visible symptoms that are tied to kidney disease. One is a persistent lack of energy and overwhelming fatigue. This isn't just feeling a bit tired. It's a bone-deep exhaustion that doesn't improve with rest. There are two main reasons for this. First, the buildup of toxins and impurities in the blood can make you feel sluggish and weak. Second, healthy kidneys produce a hormone called erythropoietin, or EPO, which tells your body to make oxygen-carrying red blood cells. When kidneys fail, they produce less EPO, leading to anemia. With fewer red blood cells to carry oxygen to your muscles and brain, your body feels tired and weak all the time. This can also make you feel constantly cold, even in a warm room, and cause shortness of breath from simple activities like walking up a flight of stairs. If you're feeling unusually exhausted and can't figure out why, it's worth considering your kidney health. Another surprising sign relates to your appetite and sense of taste. A buildup of waste products, specifically urea, in the blood can cause a condition called uremia. This can make food taste different, often metallic or off. Many people with advanced kidney disease report that meat, in particular, tastes unpleasant. This can lead to a poor appetite and unintentional weight loss. Along with this metallic taste, you might also experience bad breath that has a distinct ammonia-like or fishy odor. This is often called uremic fetor, and it happens when urea in the saliva is broken down into ammonia. So, if you're experiencing a persistent bad taste in your mouth and a loss of appetite, don't just dismiss it. It could be your body signaling that waste products are building up to toxic levels. We've covered a lot of visible signs, from your skin and nails to changes in your body and even your breath. It's important to remember that having one of these symptoms doesn't automatically mean you have kidney disease. Many of these signs can be caused by other, less serious conditions. However, the key is the pattern. If you're noticing several of these signs together, say, you have puffy eyes, foamy urine, and itchy skin, that's a much stronger indication that something is wrong with your kidneys. This is especially true if you have risk factors for kidney disease, such as high blood pressure, diabetes, a family history of kidney failure, or are over the age of 60. Early detection is absolutely crucial. The sooner you know, the sooner you and your doctor can take steps to slow the progression of the disease and protect your remaining kidney function. This might involve managing your blood pressure and blood sugar, making dietary changes, or taking certain medications. So what should you do if you recognize some of these signs in yourself? The first and most important step is not to panic, but to take action. Schedule an appointment with your doctor and share your concerns. Be specific about the signs you've noticed and how long you've been experiencing them. Your doctor can perform simple blood and urine tests to check how well your kidneys are working. The blood test checks for creatinine, a waste product. To calculate your glomerular filtration rate, or GFR, which is the best measure of kidney function. The urine test will check for albumin, the protein we talked about earlier. These tests are straightforward and can give you clear answers. Remember, knowledge is power. Ignoring signs and hoping they go away is the worst thing you can do. Taking proactive steps to get checked is a sign of strength and is the best way to take control of your health. Thank you so much for watching all the way to the end. I hope this information has been empowering and helps you be more aware of what your body might be telling you. Your health is your most valuable asset, and being informed is the first step to protecting it. If you found this video helpful, please give it a thumbs up and share it with your friends and family. You never know whose life it might change. And don't forget to subscribe and hit that notification bell so you won't miss any of our future health and wellness videos. Stay safe, stay healthy, and we'll see you in the next one.